Hello ladies and gentlemen, I'm Kunam Han from 345 Plastic Surgery Clinic. Today I will tell you about the surgical anti-aging treatments. First, I will show you the aging changes of the face. The aging changes of the face always composed of two things, depletion and sagging. Facial volume depletion always happens around periorbital area first. And with sagging, this kind of aging happens. Make it clear, this is the facial changes with aging. Inflated visible became deflated visible. But the aging changes are different from patient to patient. For example, this lady have some depletion but not too much sagginess. But this man has much more sagginess than the previous lady. So anti-aging is reversing this kind of two things. So stretching, tightening, and removal of the excessive tissues, and volume augmentation using lipofilling or soft tissue fillers are very much important for anti-aging. But we have to think about this. This kind of early 20s young lady, she complains about the marionette line and the short chin. So, is that real aging? No, that's not. Because we call that microgenia, a short chin make this kind of changes and it just looks like aging, but the rear is not the aging. So, the solution is giving the volume to the chin point by using implant. So let's start with early 20s. This is Audrey Hepburn, very famous artist. So at her age of 24, there's nothing abnormal. She's just perfect. There's no changes of aging at all. So, when to consider anti-aging at this young age, that's always associated with severe volume loss in a short time. For example, weight loss and tooth jaw and bone contouring surgeries. If this kind of volume depletion happens, as you expect, the excessive skin and remnant tissues we have to consider, and we have to manage this. So at her age of 32, this is the famous breakfast at Tiffany's at 1961. She starts to have some aging stigmata around her eyes and around her forehead. So, treatments for the young around 30s is Botox and filler. To manage the wrinkles, we have to use Botox, and to fill the depressed areas, we can use filler. And by using these two materials, we can have these kind of beautiful changes without any surgical treatment. I didn't do anything to her except Botox and filler, and repetitive managing the volume and the facial shapes. As you can see, the face has been changed, much more smaller and beautiful. And we can use Ulthera or Thermage and the other devices which has energies and which will have some lifting effect. And if you want a little bit more invasive, then we can use Mint Lift. This is absorbable PDO thread, and also non-absorbable thread materials like Elasticum. Elasticum is very special surgical treatment option, and which is very important for the making of the neck area. This is the design for the Elasticum neck lift. We call this neck band lifting, and we have to always do this with liposuction. As you can see in the picture, pre and post-operative, you can see the changes of the submental areas. We have take out the fat from the submental area and make the jawline with the neck band. And neck band lifting with liposuction for these obese patients, it's also have very much of changes. And nowadays, we have another powerful options for the skin itself. We call this skin boosters. In Korea, Rijuran and Juvederm are only two things approved by KFDA. And for the early 30s, I'd like to recommend this plus minus lifting. This consisted of three things: liposuction for the volume reduction and adhesion, and thread lifting for the lifting and tightening, and last, for volume augmentation, I'd like to reuse the liposuction fat by fat grafting. This young lady has heaviness on her lower face, and I have made it rearranged by taking the fat from here and inject the fat to the chin point. The plus means I'm adding something to the other area. Minus means I have taken out the possible volumes like buccal fat removal or liposuction. Lifting means I give something like thread lifting or incisional lifting. So these three things make this kind of changes, and the most important thing I think is doing the liposuction and inject the fat to the chin point. So rearrange the shape, and the shape has been changed like this. So this is some case of plus minus lifting before and after. And as you can see in the picture, the volume has been raised up, and here you have much more volume and rounded, and it's more narrow here. The same effect by using plus minus lifting. So let's go to the late 40s. She has already have so much of changes. She has sunken upper eyelids, she has frown lines here, and also the repetitive movement by using frontalis muscles. Maybe she has frontal wrinkles around that area, and she loses some volumes all around her face, and there happens sagging. This is the picture when she took the film of Robin and Marian in 1976. So all the tissues go down by the loosening, and the inside volumes go out, and it makes some bulging. So lower lid fat bulging, buccal fat bulging, and jowl sagging, that's happened. So this kind of aging changes are prominent at the age of 40s and 50s. So we have to do something much more aggressive than at 30s. The first thing I'd like to recommend is changing for the forehead. So I'd like to do the endoscopic forehead lift. This is incisional lifting, but there's no scar at all because the only incisions are inside the hairline. So I will use the endotine or fixed tine that will lift the tissues and fix it to the upper part. As you can see in the picture, the frowning shapes has been changed, and it looks like much brighter, and the distance from eyebrow to the eye has been elongated, and also the forehead shape has been much better. The same effect to this patient. So somebody who has very short distances from eyebrow to the upper lid, and it looks like she is always frowning like this, this is the best option for her. And for the anterior mid-face and lower lid area, we can do the mid-face lift. Mid-face lift always needs lower blepharoplasty incision, so when we do the mid-face lift, we always accompanying lower blepharoplasty. By doing lower blepharoplasty, we can manage the lower lid, and also the mid face can be lifted, and the Y-shaped depression, when we call that tear tooth and Indian bend, can be corrected by doing this mid face lift. And we can combine these two for the forehead endoscopic further lift, and for the mid face lift. And somebody who has to do incisional lifting but hesitate to have the long visible scar anterior and posterior of the ear, we'd like to recommend minimal incision SMUS lifting. The incision is inside the hairline at the temporal area, so it's easily hidden at that area. As you can see in the picture, the changes is not that much with the full face lift, but it's acceptable, and patient who does not want to have that visible scar, this can be another alternative option. And it's the same for this man. The nasolabial fold has been dramatically changed by using this kind of minimal incision SMUS lifting. But you have to think about that. If the reason of the nasolabial fold or marionette lines or jowls are because of the drooping, this is very effective. But the 3D shape and volume depletions are the major reason of the nasolabial fold and the other facial lines, then this has limited effect. So at the late 50s and 60s, she has that kind of her aging changes all over her face. This is the picture taken when she got the UNICEF award in 1989. People with different ethnics, they have different type of aging processes, but late 50s and 60s, the changes has been aggressive, and the uniform pattern has been made. So at this moment, we have to do the incisional face lifting, neck lifting, and so on. So usually, we do all the things all together. For example, this lady, this is the post-operative 1 day after the surgery. She has done the endoscopic further lift, she has done the sub-brow excision, she has done the lower blepharoplasty with mid-face lifting, and face and neck lifting also. When we do the face lifting, we always manage the volume also, so it always includes the liposuction and bulk of fat management. So this is post-operative 1 day and 1 month after the surgery. So usually, immediately after the surgery, she has swellings. Swelling means volume, and the additional swelling means that she has additional lifting effect. So this is not the relapse. This is the real post-operative result, and this is all exaggerated over result immediately after the surgery. And neck lift is always essential for these ages, but I usually don't recommend neck lift only, because neck drooping always associated with the facial drooping, so we have to manage the face first and neck additionally. But in some cases, like this patient, neck lift only has much more effect compared to the other patients. So in these cases only, in some rare cases, neck lift only is possible. And we have to think about the aging processes, not only these facial compartments. Aging processes always happen with the bone itself, and also the forehead, hairs, and around the ears, and nose, and so on. So, for example, nose are getting a little bit longer and droopy, and always the hair losses happens. So always, not always, but usually the forehead has been elongated with aging. So forehead shortening and also upper lip shortening by doing this shortening surgeries, it looks like much younger than before. And we have to think about the other things around ear. So this patient does not have done the previous facelifting surgery, but her ear shape is, we call this pixie ear deformity, right? So this is not the deformity. She has that kind of shape innate, but her shape is not good. So by doing the facelifting, we can manage the ear lobule shape also. And if somebody who has done the facelifting before and the pixie ear deformity has happened after the surgery, then we can correct the side effect by doing the secondary revision. So today I have mentioned so many things for you, but I think the most important thing for you is to meet a doctor who is responsible and who thinks safety is the first thing, and who recommends only the necessary surgeries, and who can do the surgeries carefully and delicately only for the patient. And this will make you happier. Thank you for your attention. Terima kasih. 감사합니다.